All right, Deja, thank you very much. Doctors, nurses, all healthcare providers sign up for incredibly difficult work. They know what they're getting into. But the last 6 months have made that job maybe harder than ever.
And today, we take you to the front line for the first time. 41 Action News reporter Dan Cohen is given exclusive access to an intensive care unit. He joins us live at Research Medical Center. Dan, good morning.
Taylor and Lindsay, good morning. We are now past 190,000 deaths in the United States due to COVID-19, with that toll climbing. Medical workers are still logging long hours to save lives, and we spoke to one woman who survived COVID-19 here at Research Medical Center, helped by her medical team.
And then
at the age of 82, Sharon Davies is busy.
Well, I'm an organist. I'm out and about every day. I go to the church to practice every day. I volunteer at Kaufman Center. I like to play bridge, many things, and of course go shopping and that sort of stuff.
But the pandemic put her busy life on hold. Davies was Cass County's second positive COVID-19 case. She was transferred to Kansas City's Research Medical Center, entering this hallway and this intensive care unit for more than 50 days.
I became so weak that I couldn't brush my teeth or take care of personal needs whatsoever.
Davies' stay was in a room similar to this, cared for by a team of nurses and doctors. 41 Action News was granted an exclusive behind-the-scenes peek at the front line, where healthcare providers work around the clock during this ongoing pandemic. They're doing that work in personal protective equipment. It's a process to put it on.
So the purpose of personal protective equipment is to protect the healthcare worker.
Mask, gown, powered air purifying respirator, gloves. It can be unnerving for a patient to see all of this PPE or all of this equipment.
For a lot of patients, it's scary to be in this setting because there are all these machines and all this equipment, and things are beeping, and it's a scary time.
It's also scary for every member of the COVID-19 team.
Very difficult. I have a wife and 4 children at home, one with type 1 diabetes, so she has a higher risk category if we bring a virus home, so it's been very difficult in our normal daily flow.
The rooms on the front line are kept at negative pressure to prevent virus particles from spreading. Some patients need a dialysis machine. Others need a ventilator, which requires a respiratory therapist.
You can't always save every patient. Every patient's going to be different.
Nurses say that's the hardest part, with family members not allowed in these rooms.
It's hard to see the family say goodbye from a computer screen. I think that's the hardest, is that we hold a computer when someone's dying.
Any patient that's ever passed away has never been alone. There have always been a nurse at their bedside holding their hand, being with them. We don't take it lightly that we're the last person to ever speak with them.
They haven't lost every patient. They've saved many lives.
We really do great things here.
Because we can see that we actually did make a difference. All the things that we did actually gave someone some quality of life.
They saved Sharon Davies' life. She's adjusting to a new normal after her discharge from research in May.
Well, it's a new way of life. My husband was on oxygen the last 6 years of his life, and I understand now what he went through.
She went through a lot, too.
I just never felt like I would not survive.
She survived COVID-19, cared for by a frontline team fighting for the lives of their patients.
Just very, very grateful that I survived and for all of the excellent care that I've had.
We really want to thank the team at Research that allowed us inside, and they tell me that they're still taking care of patients as we speak, and treatments that have become available like remdesivir. They say they're helping, but it's still a lot of work to save their patients. Taylor and Lindsay, back to you.
Incredible to see the work that is still going on all these months later, Dan.
Dan, I have to ask, the nurses and doctors there, did they tell you how often they have to re-up with some of that PPE? Is that a multiple times a day they're having to do that? If they take a break, they've got to take that off and throw it away. What did they describe to you of how often they're having to go through what you just showed us there?
They have a whole laundry process, Taylor. They have to take the gloves off. They have replacements for those. Robes, they have to take those off, too. They have to recharge the batteries on the PAPR, that purified air protective respirator that we also showed you. It's a constant process because they can't risk exposing themselves when they're working from one patient to the next. And we saw the whole laundry process that they have. There's a dirty table and a clean table where they can re-up. It's a constant, struggle to make sure that they're protected against the most severely infected, so they themselves aren't infected too.
Did they talk to you about once they go home, do they also have some kind of routine like that? We've heard that a lot from medical professionals, and you heard that one doctor say they have people in their homes with underlying conditions.
Yeah, they have to disrobe in the garage. They have to shower as soon as they get home. They can't risk bringing the virus inside to their homes, so they have to stay outside and take everything off, including their scrubs. I mean, even the clothes that they wear to work, they have to take those off too. It's just an extra level of protection against their families because, as you heard, these doctors and nurses are working really, really, really long hours, and they've been doing it since March.
Since March.
Nice job, Dan. Thank you very much.
Yeah, thanks, Dan. Thank you to all of our healthcare workers in Kansas City and beyond. Thank you, Dan.